I welcome you all to the Global Women's Health Awareness Session, a powerful collaboration between Women Ascension and Value Health Africa in the honor of Breast Cancer Awareness Month, usually addressed as Pink October. Today, we gather not just to raise awareness, but to ignite action, foster dialogue, and stand with women across the globe in their fight for health, dignity, and equity. Breast cancer affects 1 in 8 women worldwide, yet, early detection can increase survival rates by up to 90%. This session is a call to empower communities with knowledge, promote trauma informed care, and advocate for accessible, inclusive healthcare systems aligned with United Nations Sustainable Development Goals. SDG 3 Good Health and Well-being, SDG 5 Gender Equality, and SDG 10 Reduce Inequalities. This event brings together a distinguished panel of doctors, mental health advocates, and change makers. Together, we will explore survivor centered approaches, share lived experiences, and build bridges between policy, practice, and people. And it is my privilege to be the moderator for the impact driven discussion. I am Ms. Kanvi, a postgraduate in microbiology honors from Punjab Agriculture University, Ludhiana, Punjab, India, and also a member and a country representative along with assistant head for community outreach department for our 1 million leadership program 2030. I would like to introduce Women Ascension for new joiners. Women Ascension is a movement rooted in purpose. That is, it is a global initiative built on the belief that empowered women can transform communities, industries, and futures. With the presence in over 134 countries now and a multidisciplinary structure spanning 10 departments from STEM and climate action to peace building and media, it offers a space where women from all walks of life can lead, learn, and lift others. At its heart, Women Ascension isn't just about leadership, it's about belonging. It's about creating pathways for women to stand into their potential while staying grounded in empathy, collaboration, and service. Women Ascension's 1 Million Leadership Program 2030 is a visionary global initiative aimed to cultivate inclusive, ethical, and trauma informed leadership across sectors of healthcare, education, science, policy, and community development, with the vision to empower 1 million women, youth leaders, and change makers by the year 2030 with the tools to lead with empathy, resilience, and impact aligned with the UN Sustainable Development Goal. What's unique about this fellowship is fellows rotate through different departments, gaining hands-on experience in advocacy, digital literacy, policy, and storytelling. These are deeply aligned with UN Sustainable Development Goals, especially gender equality, education, climate resilience, and peace. It also involves mentorships for the fellows. This program does not promise instant success. Instead, it offers something more meaningful: the tool to recognize opportunities, the courage to act, and the wisdom to serve. Women Ascension Community Outreach Department is where leadership meets lived experience. It's a space for fellows to co-create initiatives that responds to real needs, whether it's addressing gender-based violence or promoting health equality and amplifying local voices through storytelling. This department is led by passionate coordinators and supported by Dr. Maheen, the founder and president of Women Ascension, Ms. Tahmina, the executive assistant of Women Ascension, Ms. Zoa, the head of the department, and Ms. Kanvi, the assistant head. This program is grounded in trust, dialogue, and cultural sensitivity. It's not about imposing solutions, it's about listening deeply, building together and honoring the wisdom within communities. A shared vision for it is together, these programs reflect a simple but powerful truth. Leadership is not a title, it's a responsibility. Women Ascension invites each fellows to lead with humility and to learn with openness and to serve with purpose. Now, I would like to introduce you all to the founder and president of Women Ascension, Dr. Mahim. She is an internationally recognized entrepreneur, educator, and humanitarian leader whose work span across academia, policy reforms, and social impact. Honored as the best global youth leader, she is a pioneering figure holding the distinction of being the first woman to earn a PhD in her region with a specialization in entrepreneurship. As a serial entrepreneur and public figure, Dr. Mahim has founded and led multiple ventures across 5 continents, including her role as CEO of Entrepreneur Ecos and the chairperson of Trade Turners, which collectively support employment, innovation, and charitable initiatives. Her business network are designed not only to drive economic growth but also to uplift under-reserved women and children from to sustainable home-based industry models. Dr. Mahim is the founder and president of Women Ascension, a global NGO active in over 134 countries now, where she led initiatives aligned with all the 17 United Nations Sustainable Development Goals. Under her leadership, Women Ascension has launched programs in peace and justice, climate action, trauma informed leadership, and environmental sustainability, empowering women with the guiding philosophy empowered by empower. Apart from being a serial entrepreneur, her contribution involves being the head of education and women development at Feed the Poor's, President UAE for the World Humanitarian Leadership Movement. Dr. Mahim is not just a leader, she is a moment. Her work embodies compassion, innovation, and the global unity, making her one of the most influential voices in today's women's empowerment and sustainable development today. With that, I would like to invite Dr. Mahim, founder and president of Women Ascension, to begin our Pink October session held in collaboration with Value Health Africa. This initiative marks the beginning of our shared commitment to advocacy and awareness for women's health, bringing together voices and leaders dedicated to prevention, empowerment, and holistic well being. Ma'am Mahim, the stage is all yours. Thank you.
Thank you, Convite. Um, Listening to you made me realize movement is not a person, movement is a group of people who pushes the boundaries and make it happen. And this is beautifully happening since last 5 years in my life. Thank you so much for this. With that, without wasting time, let me just briefly tell you about these initiations. We have a couple of initiations for Pink October, and we stand united in strength and awareness and compassion when it comes to awareness towards breast cancer. Breast cancer is not only a medical challenge, it's a reminder of the importance of early detection, emotional well-being, and community support. This platform, with collaboration with grassroots leaders, we believe that empowerment begins with knowledge. Every woman deserves access to information, care, and the confidence to take charge of her health. Together with our partners and change makers around the world, we are working to break silence, build awareness, and create spaces where women feel seen, supported, and safe. So this month, let let work on what is the prevention and mental health well-being towards Pink October, which really goes hand in hand. And that when women support women, we change the story from fear to hope. This is one clause which really inspires me, women supporting women. But what even inspires me more when we have men on ground supporting us, which makes our world even more easier to comprehend on. So together we rise for awareness, prevention, and a future free of fear. One woman, one voice, one world at a time. So thank you so much for giving me this floor. Over to you, Kanvi.
Thank you so much, ma'am, for your inspiring word. Now, since our keynote speaker is not there, but still, I would like to introduce her so that everybody is aware for our keynote speaker. Miss Diana Ongla. She is the dynamic public health leader and advocate affiliated with Value Health Africa, a nonprofit organization committed to improving health and well-being from Comity and the broader African region. Ms. Ongla is a national coordinator for Value Health Africa and also a mentor at Women Ascension, where she contributes to trauma-informed leadership, development, and global outreach efforts, empowering women and youth through education, dialogue, and sustainable health practices. Since she is having a technical issue and she will be joining us shortly, so I would just like the floor to be taken by Miss Zoa, who is my better half moderator for going through the presentation. Miss Zoa, the stage is all yours.
So much, Kanvi. Thank you so much. Good evening, everyone, and welcome to our Pink October session, Empowering Communities for Breast Cancer Awareness and Women's Wellbeing. I am Zoha Hassan, Head of Community Outreach Department at Women Ascension, and I have the pleasure of moderating this session along with Kanvi, my dear supporter. This cause is very close to my heart as well because I have seen its impact within my own family, and I know how much strength, care, community support it takes to face it. So it's very special to me. And yes, it's a reminder that behind every static, it is a real person, a family, a story. And that is the reason the conversation like today we are having is very important. Every October, the world unites under a pink ribbon, not just as a symbol of awareness, but as a reminder of hope, strength, and belief. Today, our goal is very simple but very powerful, that is to understand cancer better and to highlight the importance of early detection and to explore how communities can work together to support women's health and well-being. So we will hear from our incredible speakers who will guide us through awareness, community action, and emotional well-being with that access to care. So let's begin. And our first discussion focuses on understanding breast cancer, what it is, what is the risk factor, and why early detection truly saves life. So to help us better understand this topic, we are joined by Ms. Tebo. Ms. Tebo is from Cameroon, who will share her insights on what breast cancer is, what are the symptoms and its risk factors. Ms. Tebo herself is a public health educator and founder of Better Health for All. With over 6 years of experience in SRHR, she is leading very impactful community driven initiatives promoting gender equity and non communicable diseases awareness. So, Ms. Rebo, thank you so much for giving us your time. We are very excited to start this session with you. Please take the floor. We are ready to hear from you.
Thank you very much, ma'am. And thank you to all the panelists and the participants joining us from all around the world. I'm truly grateful to the Women Ascension for this wonderful opportunity to be part of such an insightful fellowship program. It's indeed a privilege for me to be able to learn, to grow, and contribute to this wonderful global conversation. Today, I will be sharing my thoughts on what cancer is, its symptoms, and the risk factors. So let's get started. Please, next slide. Breast cancer is a disease by which abnormal cells grow in an uncontrolled manner, forming tumor that could spread to other parts of the body and become life-threatening. It is if not treated, it remains a major public health problem, affecting millions of women all around the world, posing an escalating burden of 2.3 million new cases and 607,000 registered deaths in the year 2022, according to the WHO's data for 2025. Although it primarily affects women, that's about 0.5 to 1% of breast cancer cases occur in men, indicating that this disease is not exclusively a woman's thing, but anyone can be affected. Now, breast cancer develops when abnormal cells grow in an uncontrolled manner in the breast tissue. Most often, the milk duct or the milk-producing gland, also known as the lobules. These abnormal cells can form lumps or tumor and could multiply to nearby lymph nodes and other parts of the body if not treated in a process known as metastasis, and this can be so life-threatening. Next slide, please. There are many forms of breast cancer, and the growth of these abnormal cells may remain confined within the milk duct, resulting into a form of non-invasive cancer, also known as ductal carcinoma. These abnormal cells sometimes could break through the walls of the milk duct and spread into surrounding tissues, leading to another form of cancer, which is very invasive, known as invasive ductal carcinoma. And this form of cancer is the most common type of cancer that's affecting women globally. We also have another type of cancer. That is when cancer cells or abnormal cells that begin in the lobules, that's the milk-producing gland, and are spread into nearby breast tissue, resulting into invasive lobar carcinoma. We also have many other forms of cancer, which we are not going to get into it right now due to time constraint. Next slide. So having understood what cancer is and how it's formed, so the next question is, who is at risk? Now, there are a lot of factors that will contribute to risk towards people developing cancer. And these factors could be modifiable factors as well as non-modifiable factors. Now, what are non-modifiable factors? These are factors that cannot be changed, such as being female. The very fact that you're a woman increases your chances of developing breast cancer, unlike men. And another factor is that of age. As women grow older, the risk to developing breast cancer increases as they pass the age of 40. Another factor is that of family history. Maybe you come from a family whereby close relatives, say a parent, a child, a sibling, have been diagnosed of such medical conditions. That could also mean increased risk for you. Or you come from that family where a lot of people have had this medical condition. Additionally to the above, we also have personal history. Now, women who have been diagnosed or women who have experienced breast cancer in their left breast are likely to experience breast cancer in the right breast. And we also have the genetic factor. Now, how does this genetic factor operate? You have people who are born carriers of the breast cancer gene. That's breast cancer gene 1 and 2. So such people, they are at risk of developing breast cancer. Now, these genes are genes that will play a normal role, that is normally function as tumor suppressors. But if some harmful mutation occurs, the cyst playing the protective role and will instead cause damages to DNA within the cells. And this damaged DNA, they have a way of building up to form tumor cells. And lastly, we also have reproductive factors. Now, girls who experience menstruation, say, before the age of 12, and women who experience menopause after the age of 55 are likely, or they are at risk to the said disease. The reason is because that also means prolonged exposure to estrogen, which can fuel tumor. We also have modifiable factors. These are factors that can be changed, meaning people can take charge. They can change these factors. They can control them to reduce risk to breast cancer, such as sedentary lifestyle. Now, sedentary lifestyle means you prolong sitting in the same position or the lack of physical activity. And how does this pose a risk to the said disease? Because it leads to raised body fats, estrogen levels, and insulin levels that can fuel the growth of tumor cells. Unhealthy diet is another factor. By unhealthy diet, we are looking at a diet that is low in fruits, a diet low in vegetables, a diet low in fibers, could be sugary, a diet loaded with processed food and red meat. Such diet will increase risk to breast cancer. Another factor is that of alcohol. Now, we all know alcohol is a non-human carcinogen and can raise estrogen levels, as well as alcohol can produce toxic compounds that can damage DNA within the breast tissue. And lastly, we have tobacco intake. Now, the smoke from tobacco is carcinogenic and can damage DNA within the cells or the breast tissue, thereby increasing risk to developing breast cancer. What should women look for? Having gained understanding of what is cancer, what are the risk factors? What then should women look for? The very first thing women should look for, please take me to the next slide, please. Thank you. The very thing that women should look for will be a breast lump or thickening, which is usually not painful. If you experience such things, it's good to see a medical doctor. A change in the size and the shape and the appearance of your breast could also be a symptom that would warrant you to go for medical check. And we'll also talk about the change in nipple appearance or the skin surrounding the nipple. That could also be a factor to consider. And abnormal or bloody fluid from the nipple. That could mean the cancer had advanced. And we also talk about changes in the color of breast, which I already mentioned. And for white persons, the breast skin may look pink or red. In people who are brown and black skin, like myself, the skin could look reddish or purplish. So these are the signs to check out for. And thank you very much. I want to hand over because I had limited time to sensitize on this. Thank you very much.
Thank you so much. Thank you so much, Ms. Tebo, for sharing your insights with us and guiding us on what's breast cancer, its types, its factors, and what to look for. Because this is the basic information that every woman, but I would say every individual should have. But after this, there's another very important aspect, that is the early detection. So let's move to that aspect now. And to speak on that, we have Maria Hayat with us, who will highlight why regular screenings, examination are essential in saving lives. Maria Hayat is from Pakistan. She's a PharmD graduate and MPhil in pharmacology scholar. And she's also serving as a lecturer in Pakistan. And with clinical and research experience in hospital labs, she focuses on empowering communities through science and compassion. So Maria Hayat will guide us on how we can early detect the cancer so that we can truly save a life. It can be us, it can be a family member, it can be anyone who is experiencing such issues. So Maria Hayat, over to you. Please come forward and guide us on this in this very important aspect.
Thank you very much for introducing me. Let me share my screen. Okay, so as you know from my colleague session, Mildred has already explained what is breast cancer and what are the signs and symptoms and risk factors associated with breast cancer. My topic is early detection, prevention, and the power of awareness. So, as you know, breast cancer is the most common cancer in the women worldwide. And if we detect it early, it can save lives by identifying disease before it spread. It can also increase awareness, screening, and timely medical care are the foundation of prevention. So, why early detection matters? It matters because while early detection can increases the survival rate, it exceeded to 90% when detected at stage 1. And if detected early, it allows for lesser aggressive treatment and improve quality of life as well, reduce emotional, physical, and financial burden. There are few techniques on how to detect early: breast self-examination, clinical breast examination, mammography screening, ultrasound or MRI for those female who are high risk. Breast self-examination is most important because you can do it at your home. As Tebo already explained, it should be done once a month after the menstruation is stopped. When menstrual cycle is completed, few days after menstruation, you can do it on your own in your home. So steps include: first, you can stand before mirror and remove your clothes and look for changes in the size, shape, or dimpling of your breast. Then raise your arms, check for skin or nipple changes, and feel breast with flat fingers, circular motion from outer edge toward nipples. If there is any kind of lump, thickening, or discharge, report it to a healthcare provider. So for proper breast self-examination, I will show you one video so that everybody should be clear about how can self-examination be done.
First, check the appearance. Observe your breasts while raising and lowering your arms. Look for any changes in breast shape, difference in size between breasts, puckering, dimpling, and sores. Squeeze each nipple softly and check for bloody discharge. Check the upper part of the breasts that are easier to check in a standing position. Breast cancer tends to develop in the upper outer portion of the breast. About half of breast cancer cases are found here. So, we'll help glide your fingers easier. Use these 3 fingers to press breasts. Start from the top. Press and feel. Repeat this process while gradually moving downward. Be sure to use the pads of your fingers rather than squeezing the mammary glands. Next, move to the area under the arm. Feel for any swelling of the lymph nodes. Move your fingers horizontally towards the breast. Do a self-check lying on your back as well. Focus on the lower half of the breast. It's easier to check this part when the breasts are spread flatly. Use your left hand to check the right breast. Raise your right arm. Press the breast with the 3 fingers of your left hand. First, gradually move the fingers downward, pressing and feeling. Gradually move the fingers horizontally from outside to inside, pressing and feeling. Lastly, feel the entire breast in a circular motion. Then repeat these steps on your left breast. Make sure to cover all the area.
Okay, so now you have seen how can do we can do self examination of breast. When you find anything, now there is a step which is clinical breast examination. It can be performed by a trained healthcare professional, and it is recommended every 3 years for women around 20 to 39 years of age and annually after 40 year of age. And it also complements self-examination. If you find anything, any abnormality, you can just go for clinical breast examination. Mammography, it is another technique. It is a low dose X-ray that can detect cancer years before it's palpable. Women around 40 and above should get a mammogram every 1 to 2 years. And those female who are at higher risk, for example, having a family history or BRCA gene mutation, may start earlier around 40. Reduce It can reduces breast cancer mortality by 20 to 40% through early detection. So the benefits of early detection is that we have a greater chance of curative treatment. There might be less invasive surgeries and shorter recovery time period, lower treatment cost and fewer side effects, and it also promote confidence, empowerment and awareness. There are a few lifestyle modification for prevention. How can we prevent breast cancer? So healthy body weight is the one and foremost necessary thing. Obesity increases our estrogen level, which is directly linked to higher cancer risk. So always aim for BMI below 25 according to your height and age. Regular physical activity, around 30 to 45 minutes of exercise daily, such as walking, yoga, aerobics, or cardio, any kind of exercise. It reduces inflammation, improve immunity, and balances hormonal level, which is again linked to breast cancer. Balanced diet is also important, such as fruit and vegetable that are rich in antioxidant. Whole grain instead of refined carbs, omega 3, especially its source is fish, walnut, flaxseed, and fiber fruits that also reduces estrogen buildup in female. And also limit processed meat, sugary drink, and deep fry and high fat foods. Breastfeeding, if applicable, if female is breastfeeding, it is very good for her. Breastfeed for at least 6 to 12 months. Lower risk by controlling hormones. Stress and mental health. Chronic stress trigger hormonal imbalances. So increases your meditation, deep breathing, and mindfulness exercises to decrease stress. Limit unnecessary hormonal therapy, such as human hormonal replacement therapy, and those female who are taking hormonal replacement therapy for more than 5 years have a higher risk of getting breast cancer. So always consult your doctor first before using hormonal replacement therapies. Sleep and circadian health. So poor sleep also affect immunity and hormone regulation. It increases inflammation in our body and many other health conditions. So 7 to 8 hours sleep is recommended for every woman. Vitamin D deficiency is also linked to breast cancer. So sunlight exposure is necessary and supplements if advised to a female by healthcare professional. So by doing this lifestyle modification, you can it how can it encourage us, like we educate women about regular screening, promote healthy lifestyles such as balanced diet, exercise, limited alcohol and no smoking, and also advocate for community screening programs, as one check can change a life, maybe even save one. So early detection truly equals prevention. stay aware, stay informed, and encourage others to act early. Together, we can reduce the burden of breast cancer, one life at a time. Thank you. That was my presentation, and the stage is hand over to Miss Kanvi.
Uh, Thank you, Ms. Maria, for beautifully explaining why early detection is so important and how can we detect breast cancer as early as possible. And I'm also thankful to Ms. Tebo for sharing such valuable information with us that has guided us throughout, right? Before moving to another speaker, I would request to introduce once again our keynote speaker and our collaborator, uh, Ms. Ongla, who is a seasoned marketing communication expert with over a decade of experience in corporate and community development. She is also serving as the national coordinator of Value Health Africa, which is our collaborator as well, and where she collaborates with national and international organizations to advance public health and women empowerment. Her work and his advocacy and resource mobilization has created meaningful impact across communities, and we are honored to have you with us today. And I'm proud to call her as one of the most uh, distinguished women ascension mentor as well. Miss Ongla, the stage is all yours.
Thank you very much, Kenzie, and I'm really sorry about all those technical problems that I have. Internet with the computer, just at the last minute of my presentation, and I have it. So my apology to all the people with all the attendants and all the speakers. So I see that we already had Tebo and Aya and Maria, who already talked about the the early detection and the importance of awareness and why breast cancer awareness is really matter. So here my presentation is, if you can share it, because I think
Yes, just a second. I'm just sharing it.
yes. So my presentation will just fly over all the other presentation that you will all will hear about. So there is not something specific, but we have just to know that we will have some expert that will explain deeply what I am talking about. We are in October, the breast cancer awareness. I know that most of us, when we hear about October, we only think about breast cancer. And I hope that next year we will also think about the liver cancer that we also celebrate in October. Thank you. As Canvi told you, I am a national coordinator of Value Health Africa. My name is Ongla Dian, and also a Women Ascension mentor. And I'm happy to be part of this amazing group. And I know that we are talking about empowering women, saving lives, global breast cancer awareness, and women well-being. Next slide, please. If you can go directly to the third or fourth slide. Slide again. We're not spending a lot of time because we are a little late. Okay, so yes. Why breast cancer awareness matter? I think I think Maria and Tebo already explained in their slide why it's matter. And I know that the next speakers will talk about prevention and empowerment through knowledge. And I think there is no need to explain once again why breast cancer awareness matter, because Maria and Tebo already explained that it affects 1 in woman globally. Also explained that early detection is raise up life up to 98%. How is the most common cancer among woman and I think, yes, next slide, please. And what is important for the early screening? Yes, therapy. I think I heard how Maria explained which kind of therapy is important because, as we said, we know that we have early detection just as a medical concept. It's also, you can go to the next slide, please. It's also like to save life, okay? So that we know that when we have early detection, we also have self-guide, we have symptoms, we have that meet facts, okay? So for the for the detection, we know that if you have an early detection, you can save your life. You have this medical concept, you have mammogram, you have other screening that we used to have, but self-exam at home will stay something that can save us the most, because Maria showed you how you can do your self-exams. And I know that most of women here, if I ask someone, how many of you used to take times like 5 minutes at home to make a self-exams to your breast to know if you have something happen or if your breast is good? I'm sure that most of us know it's not like a systematic action that we used to do, but we have to do because it saves us life. It's something that saved me life as someone that actually still surviving through the breast cancer. It's saving life. Next slide. Now we will talk about prevention. Next slide. Go to the next slide. So we will talk about prevention. Prevention empowerment through knowledge. Okay, it's about why some risk factors like age or genetic can be changed. Many can't. Other can be changed. Okay, other risk factor can be changed. Like Maria talked about, a healthy lifestyle can significantly reduce the risk of breast cancer because you have these small pictures that show you what you have to change. You have stop drink alcohol, don't smoke, do your exercise, do an annual mammogram, and also not forget your self-exams. It's really important because it's really, really important. We will hear, I know that we continue to hear more of speakers that we deeply going to that topic. And I know that we also have some mental health experts that will talk about it. This is the part that I love, the mental health part, because it's really the power. Now we talk about the story. Yes, next slide. Who is at the heart of this movement? Women who live with it, women that experience breast cancer, the survivors. In this, I don't know if she's there. In this picture, you can see the ladies that we call Danielle Song. She's the survivor of not only the breast cancer, but also the cervical cancer. A very good, resilient woman. Okay, she testimony, she's advocate, she's always on the social media platform, participating to a lot of activities, not only on October, but each
Means Ongla, I guess we lost connection with you. We're not able to hear you.
Dear, can we please move to the next speaker? If Umla joins, she will continue. She can.
Thank you so much, Tamina, for letting me know to start. So we have lost Miss Wangla, but we will soon have her again with us. So thank you so much to her for sharing her insights with us on cancer awareness and women's well-being. And she's really truly doing very good work on empowering women and strengthening health system throughout her work with the Value Health Africa. So thanks to her, and hopefully we will have her again with us today. And let's move forward. We have discussed about the early detection and the basic understanding of cancer. And now we are going to focus on our next discussion, which is on empowering communities, like how civil societies drive awareness and can support victims. It focuses on how local organizations, health workers, and grassroots initiatives can help women access information and like screening and emotional support. And to share valuable insights on this particular topic, we have with us Mr. Banksy August. Mr. Banksy is a seasoned public health expert with over 12 years of leadership experience in donor-funded programs across HIV and AIDS, maternal health, and health system strengthening. He currently serves as a senior district mentor for the Safe Care Project, and he is co-founder of Community Sustainable Health Solutions, empowering community health workers to improve access to essential health services. So, Mr. Banksy, thank you for giving us your time, and we are ready to hear from your side on integrating breast cancer awareness into community health worker activities. Thank you so much. Please take the floor. I have just noticed that we have also lost him. There might be an connectivity issues from their side, so we will surely listen to them some time, and we are not going to wait for them, and we are going to move forward to our next topic, that is to understand the stigmas and myths. So see. The community health workers are not just caregivers, they are agents of change, bringing awareness and compassion and practical help to the very heart of the communities. So they have their work to do, and we have our work to do. And let's carry this understanding forward as we are moving to our next topic, where we will explore that though understanding the medical side of breast cancer is essential, but just as important is addressing what often goes unspoken, that is the social and emotional side. Many women hesitate to seek help because of fear, because of shame, and the myths that still surround this illness. So this topic is very important. To speak on this very important issue, we have with us Miss Chido Magazine, who will share her insights on how we can address these challenges within our cultural context and create safer spaces for dialogue and support. Ms. Chido is the founder of Hudek Wadza Foundation, which is an NGO that supports underprivileged and mothers of children with disabilities. Her work focuses on sexual and reproductive health rights, empowerment, ensuring that no woman is left behind due to social or economic barriers. So thank you so much for the work that you are doing, Ms. Chido, and we are very excited to hear from your side. The floor is yours.
Thank you, Ms. Noah. Can you hear me?
Yes, we can hear you.
Can you please load my slides?
Surely I will. Just give me a
Thank
second.
you. Okay, so in the interim, I'll be speaking on reducing stigma and myths around breast cancer in our communities. I'm focusing on the cultural barriers and the tailored messaging that we can use in different cultural contexts. So I'm just going to give a brief background. Breast cancer is a major global health issue, but cultural barriers often limit early detection and care. Reducing stigma and dispelling misconceptions about breast cancer is critical for enhancing early detection, ensuring timely initiation of treatment, and improving survival outcomes. Cultural beliefs, social norms, and community perceptions can act as substantial barriers to care seeking behaviors. Implementing culturally tailored, evidence based educational interventions is therefore essential to effectively communicate accurate information, promote screening uptake, and support informed decision making at risk populations. With breast cancer being the second most common form of cancer after cervical cancer in Zimbabwe, the rate of 34.25 cases per 100,000 women, but globally being the number one type of cancer that affects women, it is of import to drive campaigns and positive initiatives regarding awareness of the disease and enlighten society against unfounded myths and misconceptions on how to demolish problematic and restrictive cultural barriers and enforce tailored messaging which drives awareness beyond medical institutions but societies as a whole. Regardless of the large statistics of diagnosis, there are still misconceptions and varying levels of awareness surrounding breast cancer globally, and there are myths that are perpetuated within societies. Ms. Loba, you can just put the first slide. According to the World Health Organization, breast cancer can be described as a disease in which abnormal cells grow out of control and form tumors. If they are left unchecked, they can spread throughout the body and become fatal. This showcases that breast cancer is a disease, and if detected early, measures can be taken to preserve the lives of the persons who have been diagnosed with it. This defies the myth that a breast cancer diagnosis means instant fatality. Another myth is that breast cancer is hereditary. Research has found that only 5 to 10% of breast cancer cases are of those people who had someone in their lineages who also bore the same diagnosis, and they are caused by gene variants similar to those found in the BRCA genes. For clarity, BRCA genes are BRCA1 and BRCA2, which are two specific genes that assist in restoring mutated DNA and avert cancers by controlling cell growth. Due to misinformation, a lot of women believe that finding a lump in their breast can automatically qualify them for breast cancer, which is not true. This is also due to limited health education. There is also a very strong misconception amongst men that breast cancer is women's only disease. This is false because there are a number of growing cases of men suffering from breast cancer. But due to this myth being dispelled, men do not seek treatment, or in the instances where they are diagnosed, they do not go for further treatment of chemotherapy because of their fears of being ridiculed or being deemed as less masculine. Now I'm going to, can I please go to the next slide? Now I'm going to go to how cultural gender roles affect breast cancer, its treatments, stigmas, and shames associated with it. Culture shapes beliefs about health, illness, and medical intervention. False beliefs about what causes cancer hinder awareness and treatment. Misinformation can be taken as the absolute truth, especially when it's been regurgitated from generation to generation. Traditional roles may discourage women from prioritizing their own health. In many social contexts, a woman is referred to as a rock, unshakable and unmovable, able to weather all storms of life. Hence, women are more likely to forego necessary screenings, as their needs are usually seen as those of second or third class citizens and not as important in patriarchal societies. A woman sacrificing her health and tending to those to others is seen as the noble and right thing, even in instances where her health has deteriorated significantly. She must still selflessly serve others, especially in the culture that I come from. Resilience is awarded, whilst perceived weakness is shamed and connoted to as laziness. In many societies, women's breasts are symbolically linked to beauty, sexuality, and motherhood. Consequently, a breast cancer diagnosis and the potential for mastectomy or breast changes can threaten a woman's sense of femininity and social identity because breasts are considered as private parts in many cultures and heavily sexualized. Hence, open discussions and awareness campaigns in communities can feel like humiliation rituals. Self-exams are not practiced due to the effects of cultural modesty or even allowing another individual, be it a medical professional, to touch them as it is deemed dirty and uncouth. Some partners or husbands leave after mastectomies or withdraw their affections. This can cause a fear for women to to face divorce or abandonment, making women choose to opt out of life-saving and changing surgeries to keep their breasts. Due to the lack of information or misinformation, women are shamed to disclose fears of having breast cancer or being screened as they fear being ostracized and being gossiped about. Cultural norms do not advocate for screening where I come from. This can lead to shame, social withdrawal, and reluctance to disclose illness or seek support. Culturally, women in society are judged based on their desirability, as chemotherapy can cause hair loss as well as affect physical features. Even the density of one's posture, women are prone to lose their sense of self. Women should be viewed as more than chattel, only to be applauded when deemed beautiful or culturally appropriate. But it should be engraved within women that her worth goes beyond the physical attributes and her medical diagnosis. Another institute that adds to this is the patriarchal decision making structures. In cultures where men dominate health and financial decisions, women may lack autonomy to seek screening or treatment without a husband or family's consent. This dynamic perpetuates late diagnosis and poor outcomes, reinforcing myths that breast cancer is fatal or not worth treating. Male perceptions and community stigma. Male partners or community members may hold misinformed beliefs, such as breast cancer being contagious, a punishment, or lead to immoral behavior, which further isolates affected women and deepens the stigma. Religious and spiritual beliefs. In many societies, cancer is a taboo word, mysterious, scary, and deadly. In my culture, this is Zulu culture. A lot of women can connote breast cancer with elements of one being bewitched, as a curse, or as an act of revenge, such that women often think that the issue is spiritual rather than physical, and opt for assistance from spiritual leaders of their choice, rather than opting to pursue a medical route. Some rely on faith healing instead of medical intervention, rely on traditional healers and herbs instead of medical care. Seeking medical treatment is seen as a lack of faith and or belief. Some families hide the diagnosis to prevent religious ostracization and the belief that it is a bad omen or a sign of misfortune or bad luck. Language and communication barriers. Another barrier is the use of foreign medical terms that lack cultural adaptation or translation, as well as culturally insensitive educational materials perpetuating barriers. Now I'm going to talk on the tailored messaging to dispel harmful narratives. I have highlighted all the above to showcase how misinformation can be taken as the absolute truth. Below, I'm going to suggest the ways in which we can fight stigmas and myths without showing disrespect to people's cultural beliefs, but incorporating them so as to drive awareness and change whole literally. First and foremost, the word breast cancer needs to be decriminalized and disassociated with the word death sentence and incorporated as a disease that is not just an issue for a select few, but a community one and the global village at large. We need to destigmatize the very word breast cancer as a taboo and talk about it more freely, starting at grassroots levels, such as primary schools, even inviting peer educators to address it. As some children have parents suffering from it and are not well informed enough to understand what is transpiring, we need to do away with limited health education. As most cultures are patriarchal, it is important to include men in the conversations, but not make them the basis in which breast cancer awareness is spread, at least a different narrative is spread. A lot of women are dependent on male figures, fathers, husbands, and significant others for financial support. Hence, they are the ones likely to pay for treatment. Hence, informing them of the pros of early detection and self-testing, even for themselves, as breast cancer can physically affect them too. Also, raising awareness on the rise in cases of male breast cancer can expedite acceptance. Screening and self testing should be so integrated within society that it can even be taken as a normal routine, not something scary or dreadful. And it begins with us, members of societies who've been made aware of the stigma of screening and possibilities of having cancer to spread the gospel of this. When women see other women like them in similar social economic situations as the advocating for this, it is made more palatable and relatable to them. There is a need to dispel women as rocks, but as human beings who face health crisis, and that this does not make them weak, outcasts, or repulsive, but humans worthy of love, understanding, and compassion even when their bodies change. In regards to religious belief, whilst we must respect people's religious and cultural views, we must also strive for them to seek medical assistance too. Women should be shown the pros of medical care while they still pursue their cultural and religious obligations. Next slide, please. There should be women of faith used as examples within these communities. Those who sought medical assistance and beat cancer should be given platforms to showcase that if one woman could beat a diagnosis, it is a possibility for them too. Creating a community hero creates community hope and dispels the use of westernized medicine and chemotherapy as useless as compared to religious options. Women should be viewed as more than chattel, only to be applauded when deemed beautiful, as culture normally depicts this, but it should be engraved within society that a woman's worth goes beyond her looks. Cultural barriers affect gender roles. Cultural barriers affect gender roles deeply and shape how individuals and communities perceive breast cancer. They influence who seek care, how the disease is discussed, and the level of support patients receive. Tackling these barriers requires gender sensitive education, community engagement, and empowerment strategies that challenge harmful norms while promoting inclusivity and open dialogue and awareness. Diagnosis, treatment, and recovery. It is then of import to drive culturally sensitive education, community engagement, as well as survivor advocacy. I thank you. Can I please have the last two slides? Okay, thank you, Mr. Wan.
Thank you so much, Ms. Chido, for your powerful presentation. Thank you so much for sharing your insights with us today. What truly stands out is that how fear and misinformation can quietly shape the choices women make about their health, and how important it is for us as a society, as a human being, to replace that fear with empathy and accurate information. So building on that important perspective, we will now hear from Ms. Farida. Ms. Farida, who will speak on about the role of community in helping reduce stigma around breast cancer. Ms. Farida is joining us from Nigeria. She is an architect specializing in sustainable design and green architecture. She volunteers with organizations like Rise for Impact and Volunteer for Cause, using her platform to promote sustainability, women empowerment, and advocacy around social causes, including health and climate change. So thank you so much, Farida, for giving us your time. Please take the floor. We are ready to hear from your side.
Hello, everyone. Am I audible?
Yes, you are audible to us.
Okay. It's raining, so I had to make sure that you can hear me very clearly. I'm going to share my screen now, so you can hear from what I have to say. Can you see my screen? Can you see my screen?
Yes,
Yes, we
it's
can.
visible.
Okay, thank you. So as Ms. Canby has mentioned, I will be discussing on the role of community in helping reduce stigma around breast cancer. It is a privilege to stand before you all. When I was asked to speak, the first thing that came to my mind is not just the disease itself, but the global issue it is, the stigma surrounding it, the resilience spirits
Yes,
of a woman.
Farida, I'm sorry to interrupt you. We are able to see your presentation with the smaller view also on that. So kindly, can you adjust it?
Okay.
Yes,
Is this
yes. Now
better?
it's perfect. Yes, yes, it's better.
Okay,
You
so
can
let me
put
fix
it on
it.
present. Thank you.
Is this better?
Still we are able. Yes. Still we are able to see your shorter screen also as well. If you can fix that thing.
Let me stop sharing and share again. Is that better? Okay.
Yes.
Okay. So
Yes, now it's perfect. You can go for it.
Is this okay?
Still,
Or
we are
can you
able
still
to see your
see?
shorter screen. Yes.
Okay. I think I am having issues with my Zoom because earlier when I presented, it was okay.
It's fine. Like you can share without a whole screen also. That would go fine. Thank you.
Okay. Sorry for that issue.
It's okay,
Yes.
Farida. You can
So,
proceed.
yes, I wanted to discuss the role of community in reducing stigma around breast cancer because much as breast cancer is an issue, we also need to discuss how the community can affect breast cancer and how we view it, right? So the main objective of this session is to address, as I mentioned, the community stigma and the myth surrounding breast cancer. So is still we need to discuss it. Why does it matter? Discrimination, effects that can
Ms. Farida, actually, we're not able to hear you. I guess there is some technical issue or you're muted. Okay, since we are facing some technical issues with some of the participants, the speakers, we will move to Ms. Kiran. Ms. Kiran, are you ready?
Yes, please.
Okay, Ms. Zua, Ms. Kiran is ready. You can proceed for the same.
Thank you so much. As Farida is facing some issues with her internet, we are going to pause her and we will take her after Dr. Kiran. So thank you so much, Dr. Kiran, for joining us today. And she is going to be speaking on healing together, family network, emotional support and survivorship, and social reintegration of breast cancer patients. Dr. Kiran is from Pakistan. She is a university lecturer and a sociologist whose research explores social inequalities and vulnerabilities in health, education, family, and work life. She brings a deeply human perspective to health and well-being, highlighting how social context shape women's health experiences and access to care. So thank you so much, Dr. Kiran, for giving us your time. We are ready to hear from your side. Please take the floor.
I'm not audible. Can you hear me?
Farida, we are facing some issues from your side, so we are going to take you in 5 minutes.
Okay.
And we are taking Dr. Kiran first, and then afterwards we will move to you.
That's perfect. Thank you. I would address the issues before it
Thank
is
you
my
so
turn.
much, Farida. And also
Thank
you
you.
can share your slides with me so that I can share after Dr. Kiran is presenting.
Thank you so much. Ms. Zoha, can you share my slides, please?
Yes, I'm going to share your slides in a moment.
Yes, I am Dr. Kitani Kram, a sociologist and a lecturer of sociology at Lahore College for Women, University, Lahore. And today, while connecting with all my fellows, I'm just talking about healing together family networks and emotional support in survivorship and social reintegration of breast cancer patients. Next slide, please. So, breast cancer is the most common cancer in women in Pakistan, and roughly 1 in 8 to 1 in 9 Pakistani women are expected to develop breast cancer in their lifetime. But as far as other fellows have talked about its diagnosis and other issues related to breast cancer, I will talk about how breast cancer is not only a medical journey, but it is a social, emotional, and relational one. After diagnosing and after the treatment, the survivorship brings physical recovery and social reintegration challenges for the patients. In the situations, families, networks, and emotional resilience are the key dimensions of healing for the breast cancer survivors with the support of their families, family networks, peer networks, and the community support networks as well. Next slide, please. Survivorship beyond the medical recovery encompasses the period from the diagnosis to long-term life after treatment, which includes the physical challenges faced by the patient, the psychological one, in which include the self-esteem, the stigma, the body changes, and other acceptance challenges, social acceptance challenges, and the spiritual adjustment as well. As belonging to one of the developing, underdeveloped countries and the patriarchal structures, there are so many concerns and challenges in social and cultural aspects that the woman even face after the treatments, in which the fear of recurrence, body image, identity changes, workplace re-entry, discrimination, stigma, labeling, and emotional fatigues are included. So next slide, please. In this tough situation, when a breast cancer patient has taken the diagnosis and the treatment, the important and the most vicious role of the family is to bring them out of that trauma or from that condition of being abnormal and not fitting in the society, in which other fellows and other family networks and other peer networks can also face the communication barriers and challenges surrounding their narratives and the gender expectations of caregiving, which is very much related to the South Asian culture and with the gender hierarchies and the family structures of the developing and patriarchal societies like the Pakistan. And this is the most crucial time period of the survivors in which they need the support from their spouses, because they are the most important element of bringing them uh, bringing them out from this trauma as well. So similar to that, spouses, the parents, the siblings, and their friends are very much important, which can bring them, heal them, and make them socially integrated in their different roles, so within the family, within the community, and within the workplace as well. Next slide, please. Social networks as well as the family networks, social networks are also very much important for the survivors, because these are not only the intimate relationships, they are the secondary group members which can listen to the narratives, which can identify, which can recognize the problems, and which can bring the formal and informal solutions for the survivors, which include the community networks and the digital and online support networks even play a very much important role in making the emotional connection and the emotional healing for the breast cancer patients. And as far as the emotional support is concerned, it is very much related to the mental health of the survivors, which can eradicate the so many social psychological problems, including depression, anxiety, fear, guilt, and isolation. Because isolation, guilt, and fear is one of the most important factors which can come basically from our social surroundings, and we can find the solutions or the cures of them from our surroundings and from our society as well. So in that case, we need the counseling and the psychological education, peer mentorship program, and other health professionals integrated with the digital networks as well. So Miss, kindly move to the next slide, please. The second next slide, please. Thank you. Next one. Moving toward the cultural context and social reintegration, that is very much important for the illness and femininity narratives within the culture and within the society, which is faced by the patients, and they need to fight with the myths as well as the fatigue, the pain, and the loss and the scars within their own selves. They need to move in the work circles, social circles, and community roles, which need the confidence, which need the public discourse, and which need to speak and to bring them words of their feelings. And as far as we talk about these informal networks, the public health and policy also should emphasize to integrate the survivorship programs in the hospitals, in the national and international, and at the local and non-governmental organizations, with the rehabilitation and awareness campaigns within the community and within the supportive workplace policies for the survivors, which can eradicate the stigma and which can eradicate the fear among them to be normal and to move in the society and to move in their circles. So there are some practical approaches and good approaches. Ms. Zoha, kindly please move to the slide 10. Which includes the family education on emotional communication and care. That is very much important to aware and to create and to make advocacy among the family members to in the process of healing of the breast cancer patients, similar to the support groups and the caregivers, and the mentorship model praising survivors are very much important, including the collaboration with the sociologists, psychologists, oncologists, and the NGOs as well. So moving to the conclusion, I would say about that, Zoha, please move to the conclusion slide, please. Thank you. As far as the conclusion of the whole discussion would be that healing is a collective process rooted in empathy, trust, and connectedness. Family and community function as social capital for resilience, and empowered survivors become agents of social change and awareness for other fellows and for the other being in the same pain. So that was the conclusion of my discussion, and in which I think the important takeaways can be the survivorship, in which physical, emotional, and social integration is included. Family and networks shape recovery experiences. Emotional and mental health support must be mainstreamed in care. Rather than physical care, emotional care is as much as important, and healing should be like a building together with the community. So here are some referral studies which I want to share with my fellows and with my participants, which are very important to consult, and which are very important to study. They can basically highlight that how much these informal support and community networks are important to the social integration of the breast cancer patient within any community. So I would definitely recommend all these slides of the relevant studies to you. And thank you so much to all of you for listening me.
Thank you so much, Dr. Kiran. Thank you so much for emphasizing on the inclusivity and like explaining that true empowerment means reaching every woman and everywhere, and it's really important that families, societies, and we all contribute to it. So thank you so much for giving us your time and explaining on this very crucial topic. We now move forward to Farida, whom we had lost before. So she is with us now. So she will be presenting on her topic of reducing stigmas and myths around the breast cancer. So Ms. Farida, can you hear us?
Yes, I can hear you loud and clear. I will not be switching on my video because I think it's slightly interfering with the network. So yes.
Sure, I will be sharing your slides.
Sharing my screen. Thank you very much. So before the slides come on, I'll just introduce my topic. Well, as everyone has mentioned, they had given us very brief but very impactful sessions on how the breast cancer can affect not just the person that is affected by the illness, but also the people surrounding them. So that is what my main focus today would be, because I personally feel like when one person is going through something, it also affects the people surrounding them, and the people surrounding them, how they view what is going on with you can also affect how you heal from the disease you have. So that is what I want to be discussing. So please can we go to the next slide? The next one. Yes. So what is stigma? As I've mentioned earlier before when the talk went off, stigma involves the negative attitude and beliefs that are directed towards people with breast cancer. And this negative attitude can lead to the person having shame. They silence themselves, it leads to discrimination, and they isolate themselves. And this isolation can also lead to them delaying their treatment. So I have this quote which says, "Stigma kills as surely as cancer itself, because when women are too ashamed to check themselves and too afraid to seek help, they get too isolated to get support, and stigma wins, leading to lost lives." So a lot of people their cancer gets to a late stage, which is harder to treat because they delay their treatment and care seeking. Next slide, please. So how do we see this stigma in our society? So it can come in the form of the women being ashamed of themselves, which is self-stigma. It can lead to, it can manifest in the form of social stigma, which is community gossip. And this is like the most destructive one, because it is the one where when the ladies they feel like, oh, I don't want to go get diagnosis, because what if I do have breast cancer? The people around the community get to know that I have breast cancer. And as one of the speakers mentioned previously, cancer is in some communities seen as a spiritual attack rather than a medical condition. So they tend to think, oh, maybe it's because she's not faithful enough in some societies, and that is why she now has breast cancer. So this is one of the most destructive type of stigma that affects the community of breast cancer. And structural stigma, and we've seen cases of where healthcare systems ignore the women's concern. I've personally seen a case where a pregnant woman went to a hospital and was denied a proper checkup because they claimed it was just morning sickness and there was nothing wrong with her. She was being paranoid. And this leads to lots of issues, especially in places like Nigeria, where the healthcare is already not very good. The healthcare systems are already not very good. So if you have cases where you have delayed treatment or you're not being checked properly because of the system, it makes the situation worse, because by the time you are properly diagnosed, you are probably in the later stage of this breast cancer. And then, like what I've mentioned earlier, the cultural stigma, which is traditional beliefs of breast cancer being a spiritual attack or lack of faith. So these are ways that stigma can manifest itself in breast cancer. Then we have some common stigmas and myths surrounding breast cancer, which is people think that cancer is contagious, or if you have no family history, you're safe. Like one of the previous speakers also mentioned, only, I think, a rough 5 to 10% of people with family history are confirmed cases. So it's not like if you're completely free of previous family history, you're completely safe of breast cancer. No, you still have possibility of getting it. So it is always safe to get yourself checked. So these are some of the stigmas that surround breast cancer and why people would not go for checkups. And one of the solutions I personally think would work is open and culturally sensitive conversation in families, in workplaces and communities. And I have some few strategies that I'll be mentioning in a few minutes. Can I have the next slide, please? Next slide, please. Okay, so the previous one. Why is it that we say community hold the key to destroying the stigma surrounding breast cancer? It is because yes, it is because people trust the people surrounding them, like the religious leaders. So we have this, if we already have the mentality that it is a spiritual attack, but then we have mass of spiritual leaders and our religious leaders telling us that no, it is not a spiritual attack, but rather a test from God, and you should actually go to get yourself checked. It would help build a better community surrounding breast cancer survivors and people that have breast cancer and are refusing to go check because they think it's a spiritual attack and they're going to get judged for it. So in your community, you have cultural understanding, you have the same belief, you have the same taboos, you have the same fears. So if the community comes together and believe the same thing, because in our typical African communities, what our culture believes and what our community believes is very strong. So it is very rare to see a community where it's generally believed that spiritual cancer is a spiritual attack. It's very rare to see people willing to go for checkups because they believe it's a spiritual attack. They do not want to be that one person that has breast cancer. So when we overcome this, we give them support as a community, we would have a better chance of people getting checked under early stages and getting the treatment they need. Can I have the next slide, please? Yes, so these are the roles that community can take. I'll try to take it as fast as I can because I have a lot under this. So community can be the first line of defense. As I mentioned earlier, you replace fear, the fear that we have of breast cancer, the fear that it is a death sentence, the fear that once you get it, you're cursed or something. If we replace that fear from our families, if someone feels like, oh, I feel like I have lumps and I'm not sure, but I do not want to go check because it's a spiritual attack. But if you feel like, oh, if I go tell, let's say, my teacher this, she would help me. She wouldn't criticize me. She wouldn't say, oh, I'm cursed. If you do not feel that fear in you, you would be able to speak up and actually go get the aid you need before it gets to the later stages of cancer. So this is what is the most important aspect of community defense. And then secondly, we can use community as an application network, which is spreading information. Because like we know all these awareness campaigns, they're all good, but sometimes you need something closer, like a community, something personal, something local. So all these grassroots mobilizations, they are the better organizations. And if you have cancer awareness in your local language, like here in Nigeria, we have Hausa. If you have people talking to people in your local language, it makes them understand more what you're talking about and brings it to a closer level that they can understand it better. And again, information can be life-saving. And then we have community as a support system, which is when you have people that have breast cancer in your society, you help with it can be something as simple as driving them to their checkups. It can be something as simple as providing maybe any financial or physical support. So support system doesn't only have to be from the hospitals. Our community as well can serve as a support system. And then finally, I would like to talk about the community as an agent of change, where we have communities that demand equity. So it's not just that, the community just helps. No, they demand equity from the government, of course. So where we have demanding for subsidy in cancer treatment and local, that's the public health system that are on grassroots level. Most of them do not have the facilities to check for breast cancer. They do not even, they're not very facilitated with the process of looking for breast cancer. So if we have these systems brought to a grassroots level, it would aid better detection and early detection of breast cancer. Can I have the next slide, please? So these are the strategies I mentioned earlier, making survivors visible. So when the survivors hide in shame of surviving breast cancer, you get the stigma of, oh, anybody that gets breast cancer dies. So if we destroy that mentality by bringing survivors to the leadership roles of all those community programs, it makes the people that are genuinely going through it, they become more liable to go for their checkups. It's easier for them because they know they can survive it. So we also have community education campaign, which is like drama and theater. It can be something very simple, just like a simple play where you address the stigma in a more cultural way. So this can like dispel the myths surrounding breast cancer. And also we have changing the language. This one is very important because when you change the language surrounding it, like saying things like she's a cancer victim, to changing it to she's a cancer survivor. So she survived cancer. She's not suffering from it. She's living with breast cancer. So this can also change the narrative surrounding breast cancer. I also want to
Ms. Fraser,
on 2
sorry to
minutes.
interrupt you. Can you please sum it up in a minute since we have one more speaker left?
Okay, I would round it up.
Yes.
I'll just, yes. So I also want to just, yes. So we need to identify people that are willing to come up as champions and campaign against the stigma, because it is as important as the treatment to address the stigma surrounding breast cancer. So it is an honor to round up the discussion. Together we can save lives and educate people, because education is very important. And the more you know, the better it is for not just you, but the people surrounding you. So I hope that I have helped someone change their narrative surrounding breast cancer. And it is also a pleasure to be able to speak on behalf of Women's Ascension. Thank you very much.
Thank you so much, Farida. Thank you so much. And you have explained everything in a very beautiful manner. You have highlighted how awareness and community empathy go hand in hand, and how by breaking stigma, we can make it easier for women to seek help and support one another. So thank you so much for your insights, and we are very thankful to you. And as we move forward, it is also important to recognize that all women have equal access, not all women have equal access to information, to screening, and to healthcare. So this brings us to another topic, that is health equity and access, ensuring no woman is left behind. And to speak on this, we have Miss Ayang with us. She will share her thoughts on how partnership, policies, and collective action can help overcome these challenges. Miss Ayang is a registered nurse working with Women's Health Program of Cameroon Baptist Convention Health Services as a clinical site coordinator, and she focuses on breast and cervical cancer prevention, early diagnosis, and treatment of precancerous conditions, making a significant impact on women's health in her community. So thank you so much, Ms. Ayang, for giving us your time. Please take the floor and start speaking on this particular topic.
Good evening, everyone. I'm grateful to be part of this session. Please, could you please help share my slides?
Yes, I'm going to share your slides right now.
Miss, just kindly try to wrap up fast since we are short of time. So if you can do the needful, thank you.
Okay, thank you so much. I'll be presenting on health equity and access, ensuring no woman is left behind. This is a case study of Queen Baptist Hospital, Bamenda in Cameroon. Thank you for the slides. Breast cancer continues to top the chart globally in terms of incidence and mortality rates. The figures in Cameroon remain alarming, with an annual incidence of 4,207 new cases and 2,285 deaths. Just like in most low-income and low-middle-income countries like Cameroon, patients are mostly received at late stage with symptoms leading to overall poor survival. The theme of celebration this year reminds us that breast cancer touches the life of women and their families around the world differently, and that every journey deserves compassion, dignity, and support. This theme further recognizes the diversity of experience and reinforces the need for compassionate, timely, and quality care for all, regardless of geography, income, and background. Next slide, please. Queen Baptist Hospital is found in Mezam division of the Northwest region of Cameroon, one of the 90 health facilities of the Cameroon Baptist of specialized and generalized health facility services, serving the population on a regular basis with quality as priority. Among these special hospitals health program, a cancer prevention and reproductive health program existing for over 18 years now under 4 prongs. We have the breast cancer prevention, cervical cancer prevention, reproduction, and family planning services. Breast cancer prevention services in diagnosis. In breast cancer, prioritized to ensure no woman is left. Bamenda, Cameroon, is there where it's by Women's Health Program of Queen Baptist Hospital in providing breast cancer screening services to the population. Lessons learned and some proposed strategies to overcome these hurdles. So for the first challenge, we are having insecurity and displacement. Violence and roadblocks reduce hospital access. Outreach teams are restricted due to safety reasons. Women fear traveling for long distances. Internally displaced persons lack continuity of care. Documented attacks on health facilities have caused some people fear to move to the health facilities for care. Reduce attendance for preventive screening. Next slide, please. The second challenge we have staff shortage and burnout. A lot of kidnappings and threats against health workers have happened in this locality, and there is reduced morale and absenteeism at times from work. There is also cancelled outreach and clinic hours being shortened, limited specialists available like the oncology and pathology services, and this increased workload on the remaining staff. The third challenge, we have financial barriers. Out-of-pocket payment dominates health financing, and some of these are very costly, like the mammography, ultrasound, and other tests. And many patients may hesitate to screen if they can't afford treatment. Poverty rates about 40% nationally and is very higher in the rural Northwest. Late presentation links to financial constraints. The fourth challenge, we have late diagnosis and limited capacity. Majority present to the hospital at very late stage. The Queen Baptist Hospital may lack on-site mammography and pathology, which patient will now have to travel to other health facilities to access this care. And some may not be able to travel due to the insecurity and roadblocks. And there is also a delay between screening and confirmed diagnosis. There are few functional referral pathways and the loss of follow-up after positive clinical breast exams. And challenge number 5, we have mistrust and low awareness. The conflict has reduced community cohesion and outreach. The myths and fear around cancer still persist. Health talks through churches and market are disrupted because of the crisis. Limited media coverage in conflict-affected zones. There is lower trust in health institutions during the crisis. So here are some of the solutions to the above mentioned challenges. These are the short-term solutions. We are thinking of training community health workers for clinical breast exam, mobilize screening clinic in safer communities, transport and test and establish a transport and test voucher for poor women, and establish telemedicine link for consultation and pathology, community education through trusted leaders. For the medium-term solution, we talk about establish fast-track referral for suspected cases, implement local cancer fund and insurance pilot, strengthen telepathology and digital diagnostics, provide hazard pay and mental health support to the staff, regular monitoring and evaluation of screening outcomes. Policy and system-level action, integrate breast cancer into primary health care, include clinical breast exam in national health indicators, build regional cancer registries and data system, ensure conflict-sensitive health planning, secure humanitarian corridors for health access, institutionalize Queen Baptist Hospital community outreach in the policy. And for the quick wins, map safe outreach zones and retrain community health workers, monthly Women's Health Day with free clinical breast examination, launch transport voucher pilot for screen positive, establish a teleconsult link with oncology unit, track simple indicators quarterly like those that have been screened, referred, and if they have received treatment. Conclusively, we are trying to say that breast cancer awareness must translate into access and equity. Queen Baptist Hospital and the Cameroon Baptist Convention Health Services are key community anchor amidst crisis. Stakeholders must fund flexible, inclusive intervention. Early detection saves life, even in conflict settings. Together, we can ensure no woman is left out. No woman is left behind. Thank you so much for listening.
Thank you so much for concluding it on a very good and insightful way. As we come to the close, I would like to briefly share my reflections. Today's session reminded us that awareness, early detection, and community support are not just health measures; they are acts of empowerment. What we have discussed today inspire us to continue advocating, educating, and standing together for women's well-being. I would also like to acknowledge a few of the speakers, Miss Simo, Miss Banksy, and Mr. Damsoa, who could not be with us due to connectivity issues. Their efforts and insights remains an important part of this initiative, and we truly appreciate their commitment. Any questions or comments can be shared in our group chat so that we can continue the conversation and learning together. Thank you once again to all our speakers, participants, and organizers for your valuable time and contribution. Together, we carry forward the spirit of Pink October, spreading awareness, hope for every woman. And I would also especially would like to acknowledge the initiatives by Dr. Maheen and also Ongla and Miss Tahmina, without whom this whole session would not have been possible. So special regards to the same.
Thank you so much. Thank you so much, everyone, for joining in. And thanks to all of our incredible speakers who are with us still now. And they have presented this very important topic in a very good manner. So thank you so much. And there is one request that this discussion should not be limited to webinar only. We should include it in our daily discussions, maybe when we are speaking with our friends, when we are speaking anywhere we can talk about this. So let's take this thing in our mind, and let's leave with this concept that we won't be only limited to this webinar. We will take this discussion in our daily life as well, so that we can aware people, we can make a change, and we can make it normalize that this is not a taboo, this is not a problem, and it's a disease that should be treated as any other disease. So thank you so much for joining us, and yes, that's all about it today. And yeah.
Thank you so much, dear all. Ma'am Maheen, do you want to add anything at the end? I think we are good to go, dear all. Thank you so much.